joining us tonight is Dr. Carmencita Padilla of the University of the Philippines College of Medicine and a pediatrician from the St. Luke's Medical Center and Medical City. Good evening, Doctor. Welcome to MedTalk.
Good evening.
Birth defects. How common, Doc, are birth defects? Are you born with it or does it develop during a certain period of one's life?
Globally, it's about 1 in 28. It's really common because you have the mild ones, the minor ones, and then you have the severe ones. Most of the birth defects, we don't even know we have them. So it's possible that we may have something we're not even aware of.
Okay, so according to the World Health Organization, global issues in birth defect prevention, folic acid can effectively reduce the risk of having clefts in newborns. Dr. Padilla, what are the most common birth defects?
You know, in the Philippines, it's still cleft lip and palate. It's 1 in 500. Relatively more common than the rest of the world.
Okay. Why is that, and why cleft lip and palate, and why here in the Philippines?
Well, actually, we're trying to study that right now, trying to find an explanation, but we don't have the clear-cut explanation for that. But we know that in the Philippines, the incidence is very high. Most of these are not hereditary. It's isolated birth defects.
So, is there something that the supplements a mother can take para maiwasan to and in other birth defects in the future?
Alam mo, there are many things you cannot prevent. There are many things you have no control of. But there is one thing that you can avoid or you can prevent, and those are the neural tube defects. Ang neural tube defect kasi, ang extremo talaga is your anencephaly, no? Yung nakikita natin, anything along the spine and the brain that's affected. So may range din siya, no? Nakikita nyo yung sa TV, may bukol dito, may bukol sa likod, or let's say walang brain, anencephaly, that can be prevented 60% of the time by with the mother taking folic acid weeks before pregnancy.
Okay. So this is because it's a planned pregnancy?
Yes. Kaya ang recommendation talaga all around the world is that any woman in the reproductive age must be taking folic acid at a dose of 400 micrograms per day, 400 micrograms per day. And you have to take it long before you get pregnant.
So part of your daily supplement, ang folic acid?
Tingnan mo na lang vitamina mo. Make sure na meron kang 400. The husband can take a vitamin with only 50 or 100, but the woman needs that 400 micrograms to protect the baby in the future. There are reports saying that folic acid can also prevent cleft lip and palate, but there's still a lot of study ongoing right now to prove that. But my recommendation to the audience is if you're sexually active in the reproductive age, you must be taking your folic acid. Nakakalungkot, pag nagkaroon ka ng isang batang may neural tube defect, pag nagbuntis ka ulit, your dose should be 10 times. So instead of 400, 4,000 ka na.
Folic acid is a vitamin found naturally in foods such as dark green leafy vegetables, oranges, whole grain and yeast. Some bread, margarine and breakfast cereals have added folic acid. However, during pregnancy it is almost impossible to get enough folic acid from diet alone. You therefore need to take folic acid tablets if you are planning a pregnancy and for the first 12 weeks of pregnancy. If you did not take folic acid before getting pregnant, you should start taking it as soon as you find out you are pregnant.
What role does folic acid play in a woman's body in relation to pregnancy and the development of the baby?
It's basically it's been proven to prevent the development of these problems. Itong tinatawag yung neural tube defects, no? Kasi yung development ng neural tube mo, eventually magiging brain mo, it needs that. And that has been proven already. Scientifically based na yun.
Okay. So talagang you have to, it's a must. Prior to conception?
Prior to conception. Weeks before, hindi pwedeng, you're gonna get pregnant next week. Sasabihin mo ngayon, inom ka, no? That's too late. You really will have to take it weeks before or months before.
Kunyari, you find out you're pregnant and you start taking it.
It's too late. It's too late.
Okay, so prevention.
And in the Philippines, we have the data. It's very common. In the top 10, nasa top 10 pa rin namin ang neural tube defects. Nasa top 10 namin siya. Nakakalungkot dahil pwede mo siyang maiwasan 60% of the time. So we're trying to, together with the Department of Health now, we're trying to get enough data so that we can push for the provision of this vitamin to all women, and second, to include it in the education of the girls and the women. If government will not provide the vitamin, what I'm hoping is that there will be a campaign telling every woman that they have to take the folic acid.
And then this is the campaign. This is telling every woman to take their folic acid.
That's right.
Your body needs folic acid to help make new cells, including brain cells, blood cells, and DNA and RNA, the genetic material inside your cells. During pregnancy, you need even more folic acid because your baby's body needs it too. Folic acid helps your baby's brain and spinal cord develop normally. Taking folic acid can significantly reduce the risk of neural tube defects in your developing baby, called an embryo at this stage. The neural tube begins as a tiny oval-shaped piece of embryonic tissue, which folds into a tube about 28 days after conception. When this tube closes properly, it continues to develop into your baby's brain and spinal cord. If the neural tube does not close due to the lack of folic acid in your diet, your baby may have a neural tube defect, such as spina bifida or anencephaly. In spina bifida, the neural tube fails to close at the bottom. As a result, the parts of the spine that enclose and protect the lower spinal cord do not completely form, allowing the cord to protrude. Children with this defect often require surgery and have permanent disabilities, including leg paralysis, developmental delays, and nervous system problems. In the condition called anencephaly, the neural tube fails to close at the top, preventing large parts of the brain and skull from developing completely. Babies with this defect are unable to live and usually die before birth or soon after.
Doctor, how can a prospective mother have a healthy and safe pregnancy?
Well, number one, siguro it's planning the pregnancy. That's number one. Number two, avoid the vices. Kasi lahat ng vices, from drugs to alcohol to smoking and unnecessary medications, can have effects on the baby. Number three, healthy living. Okay. Number four, take your folic acid. Okay. So you have to take care of your body because it's the one that will take care of, that will carry the baby. Okay. And if you take care of your body and of yourself, of course, that's one way already of ensuring that the environment for the baby is going to be healthy.
For most women, the dose of folic acid is 400 micrograms daily. However, you will need a higher dose of folic acid, 5 milligrams daily, if you have a previous baby with a neural tube defect or you or your partner have a neural tube defect. You will also need a higher dose if you or your partner have a family history of neural tube defects or you are taking anti-epileptic medication. Women who have diabetes, who are obese or have bowel conditions like celiac disease or Crohn's disease also need a higher dose. Taking folic acid tablets before pregnancy and for the first 12 weeks of pregnancy is very important for you and your baby.